Welcome to the DisabiliTEA, a podcast where we have candid discussions about all things related to disability. Short-term, long-term, financial claims, impact on other areas of life, causes in the workplace, and more. With your host, attorney Anjel Burgess. You can find this show at www.disabilityhelpline.com and on YouTube, Facebook, LinkedIn, Apple Podcasts, Spotify, Google Podcasts, Stitcher, and more. Now here's the host of the DisabiliTEA, Anjel Burgess.
Hello, and welcome to the DisabiliTEA. Today, we are pleased to have with us a very special guest, Ms. Loretta Whitaker, who is a licensed clinical social worker. Welcome.
Thank you.
Well, we are so happy to have you today to talk about a very important topic, and that is the mental health aspects that are related to disability. So I know we've got a lot of great information to share with the audience. So we'll just dive right in. Please just tell us a little bit about yourself and your practice.
Well, I guess I would begin by saying I am a native Atlantan, born in Crawford Long Hospital. There are few of us relatively at this point. I went to a number of colleges, but finished at the University of Kansas with a degree in music therapy, and began working as a music therapist, and then moved back to this area, the Atlanta metro area, and began working for DFACS as a caseworker. Finished graduate school with my master's in social work, and then I entered the full-time mental health field. So I've worked at a number of institutions, hospitals, jails. I've learned from all of them. And throughout that, I've had my private practice and continue to have my private practice here in Marietta.
Excellent. Can you give us an idea of who you serve or who you provide treatment for?
That has varied over the years. Basically, children from the age of 5, because I have a lot of background in working with children. And I guess my oldest patients may be 90, 94.
Okay.
And so I will deal with the full spectrum of bipolar, schizophrenia, anxiety disorders, ADHD, behavioral disorders with children. And it's just been a wonderful journey.
Well, that is much needed. So thank you for all that you do for the community. So I want to talk about the word disabled and get your thoughts on, what it means. So as a Social Security disability attorney, I know what the Social Security Administration says to be disabled, what's required. But it seems as though there is a stigma around the word or associated with the word disabled or disability. Have you found that in your years of experience?
Yes, I have two areas basically. One is the area of people who are disabled by an observable disability.
Okay.
And the other area is the people that are primarily mental health disability. And mental health disability is a struggle because it has no outward appearance.
Right.
And people feel very defensive and embarrassed, that sort of thing. The people that have an observable disability, I think, share many of the same characteristics. A job and employment is the source of one's identity, one's social network, feeling that we have a purpose here on earth, have interchange on a daily basis with a network of people. And the job provides a level of financial security and stability to the individual, and including the family, if they have a family that they are supporting. When the issue of being disabled comes up, I think that there's a lot of embarrassment, there's shame, there's loss of identity. I think for men in particular, when they're introduced, it's with a job in mind. I'm a salesman, I do this, I do that. when they're disabled, they no longer have that. They no longer have a bridge that enters into a social interaction, a social exchange. So that for all people, I think applying for disability, there's very high anxiety because they're entering a process in which they have no control. The Of course, the reports are important, but bottom line is the board or whoever decides to approve or not approve the disability application they're the ones in control. So anytime we're dealing with something in which we don't have control or predictability, anxiety goes up. So if we're going to treat anxiety, the thing that we want to do is make the future predictable, or at least the next day predictable. We want events to be predictable. Sometimes we role play through events so that they are more familiar. And people need to have some sort of control.
Okay.
So they go through absolutely an attorney because Social Security is far more complex than what it sounds like on the outside, at least the application for a disability. So once they fill out the paperwork and they have these conversations with the attorney, then basically there's nothing more they do. All the reports they gather, releases of information sent out, and um, many times they become frustrated. They don't know what's going on. It's a lengthy process. Um, and in the meantime, all their finances are crashing. They're filing almost for bankruptcy. Um, so it's a very difficult situation to be in. Nevertheless, like I said, for all of the people, the anxiety goes up. There's a level of depression not only involved in the application for disability benefits, but the source of the disability itself, so that one no longer has the lifestyle and the identity and the ability to just optimistically move forward in life. So there's a lot of hopelessness and that sort of thing. I do, excuse me, go ahead.
You bring up a really good point. And I see this a lot with individuals who, had previously worked and oftentimes for a number of years or decades, and they may have a physical condition which basically prevents them from continuing to work. And it seems like, at least from my perspective, that even though they may have never had any experience or any symptoms of mental health challenges, that the physical nature of their condition, being out of work, that oftentimes that will lead to some mental health symptoms.
That was
So that's what you're referencing, and that's what you see as well.
absolutely the problem, I think, with people that have no history of mental health issues. It's crossing a big threshold to then reach out to mental health.
Okay.
For my mental health patients that are actually disabled because of their mental health issues, they're already part of at least a network, often the psychiatrists, the counselors, and family support, hopefully. These other people that have lived perhaps normal, hopefully stable lives and now become disabled, without exception, there's a tremendous mental health blow. They've lost everything. They've lost life as they've always experienced it. But it isn't easy to get mental health treatment. Um, I think that many times the specialists, either the primary care doctors, don't recognize that there is a mental health issue. So they're very specialized and they see exactly through their window, whether it's heart, stroke, or whatever. And often I think they just assume that, of course, you're depressed, of course, you're anxious, but not following that to the next thought of what can we do about that as well.
Okay. So what would be your recommendation or some things that an individual in that circumstance can kind of look out for to kind of help them to recognize that, hey, there are some mental health issues that I'm dealing with that I need to seek treatment for.
Mhm. The worst, of course, the big final blow is suicidal ideation,
Mm,
where they begin to think that, why go on? My life is over. I have no purpose anymore. My family would be better off without me. And they begin to have those kind of thoughts and ideations. Those are very serious. And they're the kind of ultimate concern when it comes to depression. It makes sense that people would begin to have those kind of thoughts because they often feel a burden. You know, their family has to take off work, taking them to doctors, to they have pain issues um, and other things that sort of ripple out, such as all the publicity about opiates and opiate addiction and things like that. And so they're entering a world that they've not perhaps been part of before. So the anchors that would keep them stable, such as their job, their network of social connections involved with the job, just the distraction of thinking about something else. There's a saying, people get too much in their own heads.
mhm.
Often they have nothing to do
Yeah.
but brood over their situation. So certainly those type of what we think of as the spectrum of suicidal ideation, from why go on, why wake up, all the way to perhaps having a plan to end their lives. The earlier signs that we look at is less energy, which is sort of hard to gauge if they're already sick. Sleeplessness. Sleep is a big one because during sleep, the brain actually the brain cells shrink and the spinal fluid washes out the toxins during sleep, and then they return to normal. Without sleep, the brain is building more toxins, which leads to many other issues. So, sleeplessness, lack of appetite, loss of interest in the kinds of things they were interested in at one time, even if it means watching tennis on television or watching a ball game, they just don't care anymore. The finding themselves with somewhat like dark thoughts, an absence of joy. They see maybe their grandchild or the flowers or things that used to bring them joy, and it's absent.
Okay.
These are often indicators. Not thinking as clearly, focus and concentration. These are indicators of depression. The anxiety is more physiological. The butterflies in the stomach, the difficulty maybe swallowing, sort of breaking out in sweats, a panic attack, and the defining features of a panic attack are I'm going crazy or I'm dying.
Okay.
Totally irrational. You're sitting there fine, but your brain is just flipped out. So there could be chest pain with a panic attack, things of that sort.
And if an individual is experiencing these symptoms, does it mean that they need to be on medication, or is there more of a procedure that they would need to go through with a mental health professional to figure that
I think they would certainly need to be assessed.
out? Okay.
If for the depression, in particular, we do have very effective medications. We think often of the medications for depression as protecting the brain as people go through stress.
Hmm.
Many of these things, if we think about the stress involved in not knowing about a disability claim, financial crash, all of these kind of things, stress is not just a word. We have stress hormones, cortisol, adrenaline, and they're pumping through that person's brain, and they alter the brain then in ways that we observe as depression or anxiety, for example. So that if they're very stressed and these hormones are pumping through the brain, they're not going to be able to sleep very well. I would say that maybe the first step would be to call that to the attention of whatever specialists or doctors they're seeing,
Okay.
because sometimes those doctors they're generally primary care, those type specialties. They tend to give like one or two of a certain antidepressant to everybody.
Okay.
For psychiatry has maybe 25 antidepressants to try.
Oh, wow.
We try to stay away from the popular, I guess, anxiety medications like Xanax and Ativan, these sort of things, because they can increase falls, they can become addictive, those sort of things. But they're okay short term if someone needs that. Those are the kinds of meds that probably their regular medical doctors would be prescribing. If that is not effective, then I think they need to be referred to a psychiatrist who specializes in the brain and
Okay.
how we can settle it down.
All right. And
Um,
where would counseling or therapy fit into kind of those steps?
that's a very interesting question, because in the very beginning, I think once the individual acknowledges or becomes aware of anxiety or depression, at that point, counseling can be very effective.
Okay.
Counseling would help them understand what's going on with them. Counseling would educate them, explain their options, that sort of thing. Um, I guess I would say that it's unlikely to happen because if people are focused on their physical issues, I'm having a heart attack, when really it's a panic attack, they're
Mhm.
not very willing to consider it being a panic attack.
Right.
So the counseling, I think, should come in the very beginning. There are techniques we can use to just help, certainly with anxiety, relaxation techniques, things of that sort, without medications. And I think with depression, it really helps all brain issues to verbalize. So if the person has a confidential um, person that they can put into words exactly what's going on, all of their depressions, their hopelessness, their change, that can be a big relief, because it's hard to do that with relatives and friends.
Sure.
They burn out. They're tired of hearing it. They've said it before and they don't want to hear it anymore. And the person's life is already socially compromised. So they're more concerned about pushing away, and other people don't understand.
Right.
They do not, unless they've been through it, they do not understand. I find, though I've not seen this, but I think groups are very helpful when we know we have AA for people recovering from alcoholism. We have all sorts of 12-step groups. And the big relief is I'm not alone.
Mm.
These people know exactly what I'm going through. I don't find groups for people disabled or going through disability unless it's a specialized support group. But that would be very helpful should that exist.
Okay. So if someone's able to perhaps identify, a support group, you would recommend looking into that as well.
If if such a thing exists for people going through disability or who have become disabled, they often would not identify, say, a group therapy of people with anxiety disorders,
Right.
because maybe the root of their anxiety disorder is reality, that they have lost everything, where other people there may simply have a biological anxiety disorder that's irrational. So it is complicated in for people to reach out for help. I think the bottom line is we have to take what's out there. You have to tell the doctors, they're the first line of communication generally for people going through disability or becoming disabled. And then through the doctor's recommendations, go from there. Ideally, being part of a support group, having a counselor, having a psychiatrist who can really fine tune the treatment for depression and anxiety with minimal side effects
Mm.
and with minimal interfering with other medications the person may be on, because then we can have cross cross impact, so that one medication will increase the blood levels of, say, another medication the individual's on. So it becomes to be pretty complex medically, but psychiatrists are trained to deal with that. I think the other thing that's important is that the individual understand that they have their identity is not I am disabled.
Mm,
There are many other aspects to their life. And
sure.
sometimes, yeah, they forget that with their depression, their loss of interest. If they were interested in rebuilding cars, they can still hopefully go to a car show. They can still have discussions. They can still order magazines. Anything they can do to either maintain earlier interest and hobbies or find new ones is extremely important because the individual is still a child or a parent or some sort of relative. They still have skills and education and things that they've learned in the past. They have wisdom that they've gained from their life experiences. And it's more than their body becoming disabled.
I
So,
think that is a fantastic point. And perhaps part of the problem is that if an individual is going through a process like disability, there's so much
mhm,
emphasis while you're going through that process on
right.
what are you not able to do. That
Mhm.
it certainly seems logical that it could take away from, someone's thinking like, well, what can I do? Despite
Yes.
these challenges. So I think that is a fantastic point. Um,
Mhm.
and I'm sure that would also help with, any depression or any mental health
Yes.
problems that an individual is
Mhm.
experiencing.
Yeah. And sometimes individuals, they love a particular type of music. And so they can take maybe breaks during their day and listen to their music. The more that, for anyone, the more that we have a structure and a routine for our day, it just resolves a lot of other types of issues, such as unpredictability.
Okay.
So, if they are low on energy, maybe they can work on chores maybe for 20 minutes and then they need to take a 20-minute break. But once they realize they can work on chores for 20 minutes, you see, then they're maximizing their abilities and they feel more worthwhile that they're contributing something. But it's okay to take breaks. It's okay to learn about one's body and see what one can tolerate. And when the limit is reached, take a break. But it doesn't mean don't give it a try.
When an individual is in counseling, are these
Mhm.
some of the things that would be discussed? Um,
Oh, yes.
okay, okay,
Oh, yes. What I do with an individual, certainly a new patient, would be really going through in detail what are the limitations. Well, first, maybe we would begin with what was your life like before?
okay.
What caused this disability? And a lot of times, excuse me, there's guilt if the person feels that they maybe they were a marathon runner and they had an injury, but they kept running marathons and now they're in bad shape. So if they feel that they can look back with some sort of regret, if I had not done this, if I had not done that, we find that very often. There seems to be a basic human need to have some sort of control, even in situations in which we had no control.
Mm.
So you're riding the bicycle, hit a manhole or something, and now broken back and all these injuries. People will tend to go back and say, if I had gone a different route,
Right.
if I had, you know, because they're trying to convince themselves, I think, that they had some sort of control, they contributed to this disability in some way, even though they did not in reality. So, looking at the sort of emotions that come about, guilt is often there because the feeling that I somehow caused this, or if I tried harder, I wouldn't be like this. And then that's projected onto one's environment. Everyone around me thinks I'm lazy. Everyone around me thinks I caused this. They think, I'm not trying. And they may not at all think that. You think that.
Right.
And you're projecting it to everybody else thinking that. So that's definitely a factor.
So if an individual is in counseling, do you communicate with that individual? Like, let's say they have a psychiatrist. Do you
Mhm.
communicate with the psychiatrist about, the counseling, or is there any sort
Oh,
of,
yes.
okay,
Oh, yeah. Oh, yeah. Because at least in my situation, the primary psychiatrist I've worked with, we've worked together for 35 or 40 years maybe. And we communicate often because psychiatry, especially in the age of managed care, the psychiatrist is limited to maybe after an assessment, they're limited to maybe 15 or 20 minutes with the patient.
okay,
If one is seeing them in counseling, and that's maybe once a month, every 2 months, 6 weeks, whatever. Um, in counseling, we're seeing the patient 45 minutes to an hour, maybe at least once a week.
okay,
So we get into a lot of things
right,
that psychiatry would not be aware of. I also communicate often if I'm seeing any signs of a person becoming more unstable, increased depression, or if some event has come, like some relative has died or something of this sort, that puts them at risk for a plunge in depression or some change in stability, then I warn the psychiatrist, this has just happened, be aware. Um, I think the one thing that's really an issue in mental health, we have no labs, we have no x-rays, we have nothing except what the patient most of the time has identified as a symptom. So I may see patients 2 or 3 years, and then I just happen to ask a question or something comes up that they're telling me about something, and I realize they have a major symptom.
mm,
And it may be stomach aches, it may be sleeplessness, um, many things, but until the individual identifies this as a symptom and verbalizes it, we can read mood somewhat, we can read emotion, we can read energy and interest to a degree,
okay,
but especially things like obsessive compulsive thinking. The person tries to hide it anyway. They pretend they dropped their keys so they can look under the car before they get in it. And so, um, unless they bring up the symptom, then we're not aware of it.
okay,
And I would go back when I say the patient developing depression, anxiety, talking to their frontline doctors they have more contact with, unless they bring it up to that doctor really, unless they're doing a mental health scan, would have no way of knowing it,
yeah,
um, because it doesn't show. And individuals feel that they should be able to do better, that they don't recognize that the brain is a very, very complex organ of the body, and we have relatively little control over making it function. So,
well, you have shed some really critical light on, mental health and how it can affect an individual that is disabled or dealing with a disability.
mhm,
And I really want you, if there are any nuggets that you would like to share, any tips, any things to look out for, specifically as it relates to an individual that had no prior mental health symptoms,
mhm.
before going out of work or before becoming disabled. Is there anything that you would like to share, to speak to that individual?
Well, I would go back and say also one symptom of depression is irritability.
Mm, okay.
And that one is harder. If someone's sitting and crying and laying in bed and they look really sad, people will say, I think they're depressed. But if they're snarling and lashing out at everybody and driving everybody out and things like this, it doesn't come to mind
Right.
that they're depressed. So um, I think that one factor involves family and the people around the individual. Um, they're far more likely to observe the behaviors than the individual
Yeah.
because our own brains experience the world and interpret the world through our own filter. So oftentimes it's like, I'm normal. I don't know what's wrong with you,
Right.
but I'm fine. And the people that are dealing with them are the ones that can see maybe changes in mood from before the injury or the presence of the disability. So it's very important, I think, for those people to intercede in some way. And it may be, again, talking to their primary doctor to try to bring attention to it. Um, it may be telling the individual in a very non judgmental way, it looks like you're really struggling. And I think we need to do more to support you,
I like that.
even if even if they're snarling, you know, because beneath the snarling, they're struggling.
Right.
And it's important, I think, in approaching anyone that we try to be non-judgmental because that person's doing the best they can. If they could do better, they would. And it may not meet our standard or their standard, but it's the best they can do at that moment. So approaching it from the fact of, this is, you're really taking this hard. I think we need to do more to support you. Let's at least talk to a counselor just to see what their thoughts are. It's easier to get someone into counseling if there's a requirement. Like, I think this would help your disability case. So that now you have a complication of depression and anxiety. So sometimes motivation is very important. And even though that sounds a little crafted, if that helps a person get the help they need, then we have to try to look at the thread their thoughts are taking and follow their lead, I think. Some things that I say to patients that I think are helpful. Um, One is a sort of a little motto that just because I think it does not mean it is true. And sometimes I make a little poster to put up. I'll never be better. Life is over. Who belongs? Whose thought is that? Yours. I think it does not mean it is true. So we seem to accept any passing thought that crosses our brain as truth.
Mhm.
But it's important to question those and say, is it really true? Does all the evidence support that thought? So that's one. Just because I think it does not mean it's true. I think another one is to everything a time and a place. You're going through the storm right now.
Mm.
That does not mean it will always be the storm. There is a future. There will be things happening in the future that you cannot predict or don't know about. Um, I think assuring people that they are not alone. You know, Other people are going through this with you. And sometimes it's sort of not really a guilt trip, but it's like it would help me if you talk to a counselor. This is more than I can handle by myself. I
Mm.
need more support. Um, and sometimes, dear Abby says this a lot. If the other party will not go to counseling, then you go to counseling to get help dealing with it.
Okay.
So that's one that I think is an important way of approaching it. Is that the people suffering and struggling with the disabled individual can at least go to counseling and get some ideas themselves that they can pass on. Um, the the thing I mentioned earlier about that is not all of who I am is being disabled. what else am I? What else can I do? And linked to that, some people have this thought of like, what is my purpose in life? Why am I even here? I have no role, no purpose. Um, Finding something as a purpose in life, I think, is very important. If it's just that the grandkids love to come in and say hello to you, or how are you important to other people, or maybe you, um, depending on what the individual does or can do still, I think that's to have a purpose is very important.
Absolutely. Absolutely. Wow. I mean, you have shared some really, really great tips with us, really provided a lot of great knowledge
Mhm.
for not only individuals that may be listening that are experiencing mental health symptoms, but their family members, because their
Oh,
family members are so critical. Um,
mhm.
and the support that their family members provides is essential. So I
Yes.
thank you also for bringing the family members into the discussion, and that they too need support. So tell us how anyone can contact you if they are interested in having an assessment or just talking about counseling, and how counseling may be able to help them.
That would be very nice, except my practice is packed. I
Oh,
can, but I'm glad to talk to people, and I'm glad to do a consultation and refer them.
okay.
Um,
Well, that's very
because there are, I, I will say through the internet, many things are available to people that were not available before, even support groups, Facebook groups,
helpful.
things like this. People that are not mobile and that are not able to get out and attend things are able to have contact with other people. So even on websites like Psychology Today, things like that, people can search and find counselors with sort of a biographical background and interest in insurance they take, which brings up another issue with people going through disability, um, that often they don't have insurance coverage, and that is very difficult. It's a big relief when they get Medicare. The county does have the community service board. You know,
Yes.
they charge on a sliding scale. Some of the nonprofit agencies charge on a sliding scale. So I really think the last thing anyone needs to do is go to a private counselor with a credit card and just dig themselves deeper
Okay.
in debt. You know, I think there are resources available, and sometimes they do have insurance through a spouse or something of that sort. But my phone number here is the 770-426-6460. And as I said, I'm glad to talk to people and
Yes.
consult with them. Um, but I have a lot of long termers.
Got a full plate. That's a good problem to have.
It really is. But I also feel that maybe in many ways I can serve better at this point by teaching. And um, I am a field instructor for University of Alabama graduate program and things of that sort, where I teach interns and provide supervision. So I like to more and more people to really be available. There's so much need right now.
Yes, absolutely. Well, thank you so much for sharing such valuable information with us, and for pointing out for people that don't have health insurance, that
Mhm.
there are resources that are typically available through the county that you live in. There is typically a mental health service that's
Mhm.
available that you can reach out to if you aren't currently insured and you're not able to
Yeah.
afford private services. So another
Yeah.
great point.
Yeah. There is the new mental health line,
Okay.
which is, I think, 988. I should have been prepared for that. That is trying to go nationwide. It's the equivalent of 911, but
Okay.
it's a mental health crisis line,
Excellent.
and that's a good one to call because I have not explored it, but they should have resources and ability to connect people with services.
Okay. Well, I'm going to look into that because that's an important resource for me to know about. So thank you for sharing that.
Absolutely, absolutely.
Well, thank you
So,
so much, Ms. Lorita
oh,
Booker, for joining us and sharing your knowledge with us.
I
Um,
love it. Thank you.
well, we love it too. Hopefully we can have you back and talk some more. There's so many important things to talk about as it relates
Oh,
to.
yes.
So we'll talk about when we can get you back on and talk some more. Um,
Okay.
in the
Thank you.
meantime, we hope that you all have found this to be as valuable of a resource with great information. This has been another episode of the DisabiliTEA, and we look forward to talking with you next time.
You've been listening to the DisabiliTEA with Anjel Burgess. Thank you for your positive reviews, comments, and sharing the show with others. You can catch prior episodes at www.disabilityhelpline.com and on YouTube, Facebook, LinkedIn, Apple Podcasts, Spotify, Google Podcasts, Stitcher, and more.